Mm.
And what would you like to see from the new government now that that's in place?
That's a really tricky question because there are so many things. I think fundamentally, I'd like maternity care to be prioritised. I feel it's very short-sighted that we don't put more effort into pregnancy and infancy, because if we did that, then we would be growing a much healthier population. So if we put in the effort now, in 20, 30, 40 years time, think of that impact. But that's such an enormous thing. And I think A&E and waiting times and social care, all these things get a lot of priority, and rightly so. But I think maternity can sometimes get a bit bottom of the list and a bit forgotten. So prioritising maternity care. And then within maternity, I think we've got to do something that makes it a better place to work, particularly for young midwives. We're seeing massive attrition of young midwives. I think there's some horrific statistic about only 1 out of every 25 midwives trained stays in the profession. And it's that they're keen, they're enthusiastic, they want to do the job and do it well. And we need to work out how to make it a better place for them to work, whether that's, my job is a mixture. I have some clinical, and then I have some time where I'm doing perhaps a risk review or education or other things. And clinical midwives don't have that. And if they had that as part of their job, then they wouldn't get burnt out and leave quite as quickly as they do, because they'd have some respite and they'd have a bit more variety rather than just day in, day out working a solid 12-hour shift. You can't care for people unless you're being cared for. And I'm sure you know Kate Greenstock, and she's a wonderful midwife at Kingston. She's temporarily left us because she's abroad, but she wrote an amazing book, Flourish, combining kind of coaching with psychological caring for yourself as staff and recognizing how difficult maternity is to work in.